a boy. Do we have any boys at home yet? No.
Perinatology is also referred to as maternal fetal medicine, and it's a subspecialty of obstetrics and gynecology. So I have actually had training and I'm board certified in obstetrics and gynecology, but then I've had extra training in high-risk pregnancies. An OBGYN undergoes 4 years of postgraduate residency training in obstetrics and gynecology, or women's health. The subspecialties of obstetrics and gynecology are number 1, reproductive endocrinology and infertility, number 2, gynecologic oncology, and the third one is maternal fetal medicine, or MFM, and it's a subspecialty that involves primarily complications of pregnancy. Board certification is done by the American Board of Obstetrics and Gynecology out of Dallas, Texas. They go through and certify that your education, experience, training, and patient care follows a certain standard. Board certification in obstetrics and gynecology is done by both written exam and an oral examination in Chicago. Additionally, maternal fetal medicine also requires a written exam and an oral exam by experts in the field. Board certification is the basic groundwork or education that everyone needs to become a good physician. However, your experience and your compassion that you learn along the way is vitally important. The requirements to be a specialist in maternal fetal medicine are 4 years of college on average, 4 years of medical school where you learn the basics of being a physician, followed by 4 years of residency in obstetrics and gynecology. This is then followed by now a 3-year fellowship program in maternal fetal medicine. For example, I was 32 years old before I saw my first patient in private practice. The average age is about 35. That's a long time to be in school. I believe what makes a good doctor a great doctor is listening to your patients, customizing a treatment plan based on that patient's needs, and holding her hand along the way. There's nothing better in this world than to have a patient tear up, hug me, and thank me for being her guide through a difficult pregnancy, regardless of the outcome. 75 to 80% of most MFMs do their business from prenatal diagnosis, which means using ultrasound to diagnose a baby's condition both externally and internally. For example, I've done almost 75,000 ultrasounds in my 16-year career. MFMs also perform blood tests on the mom, as well as invasive testing such as CVS or chorionic villus sampling, amniocentesis, and fetal blood sampling to do definitive diagnostic testing on the baby. Some maternal fetal medicine practices focus solely on prenatal diagnosis with ultrasound and prenatal diagnostic testing. But in my practice, as in many MFMs, we also focus on maternal complications of pregnancy, which include any diseases from the head to toe, whether it's a stroke or brain abnormality, cerebral palsy, complication with the throat, head and neck tumors like cancers, complications of the lungs, pneumonia or asthma, heart disease including heart attacks, kidney problems, liver issues, or gastrointestinal problems. I consider myself an internal medicine specialist for any complication of pregnancy. I hope you have a better understanding for the field of perinatology. For more information, please see our website and view our other videos. Thank you.